What does it mean to... Well, we are, again, this is not enforceable, right? So it's an encouragement to everyone, scale back non-essential, and we say one contact per day. So imagine if somebody says, look, now it's five persons rule, all vaccinated. I can go out for breakfast, lunch, dinner, and I can have, I can even do a house visit after dinner. I can have multiple contacts. Yes, it's permitted under the rules. But I think the more we circulate, the more we are out and about, there is always a chance that we, by circulating around so much, may inadvertently become the source of the next super spreader event. And we are trying to ask people, please hold back, particularly during this period where there are so many cases and where the virus is spreading so quickly. Just scale back, cut back your social interactions, if possible. Go out if you need to, but if they are non-essential activities, scale back, exercise some restraint and moderation. For work from home, that continues. We have already provided the guidelines that 50% of staff who can work from home can now go back to the office. So that remains. We are not changing that guideline, but we are asking all employers to test regularly the staff who are working on-site. And as I said, we are going to distribute ART test kits to employers so that they can administer these weekly tests for their staff who are working on-site in order to ensure that their workplaces remain safe.
Minister, with this spike in number of cases and the appearance of big clusters recently, how will this strengthening of public health actions have an impact on our vaccinated travel lanes with Germany and Brunei that will commence in two more days?
We are continuing to, with all the announced activities and the programs and pilots and the vaccinated travel lanes that we have announced, we are continuing. So we are not stopping any of the things that have been announced. We are not going back to a heightened alert. We are not tightening up restrictions. We are not doing that. What we are trying to do, as I said, is to try our best to refrain from having to adopt a tightened posture, but still be able to slow down transmission as much as we can through more aggressive contact tracing, more widespread testing, and finally, by everyone doing their part and exercising social responsibility. So it's a reflection of our new phase, that we have a much higher level of vaccine coverage and protection, and therefore we don't have to go back to the heightened alert or tightened posture restrictions, but we can hopefully slow down transmission with all of these measures. But as I said, if, despite our best efforts, we find that the number of serious cases needing oxygen and ICU care goes up sharply, then we may have no choice but to tighten our overall posture. So we should not rule that out.